Good evening, viewers. Good to have you back here on the Urban Debate. Tonight, we put our focus again on the COVID situation in our country that is getting trickier by the day and worsening, in fact. Prime Minister Modi himself conducted a meeting with all the state chief ministers, and he had a big message, really, not just for the state chief ministers, but the entire country, that India is witnessing a second wave that must be stopped. His emphasis was that we all need to get together and stop this second wave. The states like Maharashtra and Madhya Pradesh are seeing a worrying rise. Prime Minister Modi said that decisive steps must be taken, and these steps have to be taken at every level to contain the spread of the infection. We need to be more proactive, essentially. We cannot be showing a lackadaisical attitude which has set in, especially in many of the states when numbers came under control in the last few months. He reiterated the fact that we need to increase our RT-PCR testing, and because it is difficult to handle the spread when it reaches the villages, we must ensure that doesn't happen again. Of course, there was a message to speed up vaccination, ensure there is no laxity in following COVID norms, and that wastage of vaccine, 10% in states like Telangana and Uttar Pradesh, must be reduced. Some of these things we have been telling you over and over again, and we will not stop until the message goes across to everybody. And so today, as the Prime Minister of the country takes the lead in sending across the same message to the country, we also have the biggest of the experts who've been handling COVID strategy for us joining us here on the show. We've got comments coming in from Mr. N.K. Arora, who's on the task force. We've also got Dr. Samiran Panda of the ICMR, who will be joining us on this show. But first up, I want to go across to Dr. Randeep Guleria of AIIMS, who's joining us right now. Dr. Guleria, always a pleasure to have you with us.
Thank
For
you.
our viewers to understand, what does it mean when we say we are perhaps looking at the second wave or in the second wave, and will this one impact the entire country?
Currently, we are at a crossroad, and it's a big cause of concern because we are seeing a rise in number of cases, and today we've had a large increase in the number of cases, the second highest that we've seen in this year. And this suggests that we are heading towards a second wave. It is in our hands to see which way we want to go, whether we want to work aggressively and flatten the curve and bring this spike down as early as possible, or allow it to really go out of hand and spiral out of hand. And that is why currently, when the cases are not that large, we have to be aggressive, and we have to learn what we have learned last year in terms of the action that we need to take, whether it be COVID appropriate behavior, whether it be testing, tracking, isolation, testing more and more people in the area where you're seeing the spurt, so that we pick up all those positive cases and isolate them so that they don't spread the infection to the others. And this time we also have another weapon in our armamentarium, and that is the vaccine. So we need to really push and see that we are able to vaccine as many people as we can, especially the high risk group and those with comorbidities, so that our mortality also stays low.
Dr. Guleria, let me ask you one question before we go to the steps that one must take. What's changed between what we saw, say, in December or January than what we are seeing in March? You know, the understanding for a common man will be, well, everything was open even then. We could get out, we could travel across the country, we could visit restaurants and, bars, public transport had opened. So why is it that we are witnessing this surge only now?
So there are two or three things that have changed. One is people have started feeling that now the pandemic is over, and they have started really not following any norms at all. You have to just see how things are outside, and you will see that people have stopped wearing masks. There is a huge crowds which are happening. You have functions going on, marriage parties, other functions going on where crowds are in hundreds, despite whatever be the norms or the regulations that are there. And any of these events can be super spreading events. This is exactly what has happened in certain states, that they had huge crowds and there was a few individuals who were infectious. They spread the infection to others, and this led to an increase in number of cases. Also, we are worried that we may have some variants which may come in, because we know there are variants which are more infectious. And if we don't have COVID appropriate behavior, then we're giving the chance of these new variants, if they are there in the community, to spread more rapidly and cause this high spurt in the number of cases. So whether we have variants or we have the old strain, COVID appropriate behavior will be able to prevent the spread of infection. And that is what we need to do very, very aggressively. People have started thinking that because we have the vaccine, now we need not do anything else. And therefore, we don't need to follow COVID appropriate behavior. That is what has changed dramatically.
Well, and that's something that, we repeatedly keep telling our viewers as well, that the COVID appropriate behavior is extremely important. Now, let's look at some of the aspects of it, Dr. Guleria. The biggest weapon in our armory is perhaps vaccination and speeding up vaccination. Now, there's a lot of speculations, some hopes that maybe we'll open it up to the next phase very quickly. What's your own sense at the pace that we are seeing and the stocks that we have? When will we be able to open it up to more people?
I think we need to really look at two or three things. One is, what is the aim of vaccination? The first aim of vaccination is to save lives and prevent mortality. And therefore, we must, in the first phase, vaccinate the high-risk group, the elderly, those with comorbidities, as early as possible before we open it up. Secondly, we have to have an assessment that we have enough doses to vaccinate everyone as we start opening things up. Remember, we need 2 doses of both the vaccines. And therefore, if we are even looking at 30 crore individuals, we need 60 crore doses. That's 600 million doses. We have to be sure that we have those doses. Otherwise, we will land up in a situation that we have given the first shot and we don't have the vaccine available to give the second shot. Thirdly, we need to look at situations where we may be missing out on those individuals who are in the high risk group, who are in the priority list. But for various reasons, they may not be tech savvy, they may be in rural India, or they may be in a town where they're not sure where to get themselves vaccinated. We need to reach out to these people and get them onto the vaccination site so that we're confident that at least the priority list has been vaccinated. Once we are sure that we've done that, we move on to the next step of trying to open it up to more and more people. But this has to be done in a graded manner. We are already doing around 3 million vaccines a day. We can ramp it up, and I'm sure in the next few days it will go up to at least 5 million a day.
5 million a day. That's what we are hoping for. That's what Dr. Guleria is saying. A lot of our focus, Dr. Guleria, even, and I must admit, even from a coverage point of view, gets restricted to the bigger towns and cities. Like you pointed out, it's very important to include all parts of the country, all segments of the population. Now, what would your advice be to the states? How can we ensure, what do we rope in that can become centers, people who can be used to take it to far off places?
So each area, one has to look at different strategies. For example, a mega camp or getting the volunteers or NGOs on board so that they can get the elderly people to come from their house, give them the transport so that they come to the vaccination site. And like a camp, they are all vaccinated on that day. Doses will also not be wasted because you can get all of them there. And once they're vaccinated, they can be transport can be provided so that they can go back to their residence or house. So that can be done in rural India. We also need to really focus on increasing awareness among people in rural India, because many times when I tell people in rural India that you have to get vaccinated, some of them say that, this is a disease of big cities, it's not a disease of rural India, so maybe we should not get vaccinated. So we have to overcome vaccine hesitancy also in those areas, but also facilitate vaccination in these areas where people may want to get vaccinated but don't know how to go about doing it.
Since you mentioned this is a disease of the big cities, seems to be a perception. There's also a perception now that it's only a problem, obviously based on statistics, in states like Maharashtra. Now, some of the other states, Madhya Pradesh or Punjab or Gujarat may be seeing signs. But is Maharashtra, should we treat it as something of a warning that if it's happening in this state today, it means that it could happen in any other part in the coming weeks?
Exactly. I think this is a warning. And we must also understand that even if it's only limited to Maharashtra, Punjab or other states, people will travel from these states to other states. And we know that a large number of people who will be infectious will be asymptomatic. They will not even know that they have COVID infection. And they may travel from Maharashtra to other states, carry the infection with them, and then spread the infection to others. Recently, I saw a patient who has actually gone to attend a marriage in Bangalore, and the entire marriage party got COVID positive because they did not have COVID appropriate behavior. So people will travel from one place to the other to attend functions and carry the infection with them.
One other, controversy that has left doubts in the minds of people is that about the Astra Zeneca vaccine, especially with 12 European nations banning it. Even in Asia, Thailand has suspended it right now. Now, why is it that there seems to be a larger concern there than in our country?
If you look at data from our country, and even if you look at data which has emerged from UK and Europe, in UK and Europe, more than 17 million people have received the AstraZeneca vaccine. In India, we have had more than 3 crore people who have been vaccinated, and bulk of it has been the AstraZeneca vaccine, that is Covishield. We have not seen any suggestion or any increase or any case that suggests that there is increased blood clotting. Blood clotting can even occur otherwise in the elderly, in those who have comorbidities, and therefore this is the important issue is whether this is due to the vaccine or it would have otherwise also happened even if you did not take the vaccine. The feeling that is happening by most of the authorities, including WHO, by looking at the data is that this is incidental, coincidental rather than a cause and effect. And therefore, it seems that it's nothing to worry about. But whenever such things are sort of raised, it's important for the authorities to really go into the matter thoroughly, and that is what is being done. But I'm quite confident that probably it's unlikely to have a major impact as far as the vaccine rollout is concerned.
Yes, in fact, the WHO has also said that the benefits far outweigh, any risks that we've seen so far. Interestingly, in India, we haven't seen any cases so far of blood clotting. Dr. Guleria, thank you so much for joining us and, really bringing about the message which I feel we cannot stop emphasizing enough, which is that people need to follow COVID norms. You and I need to wear a mask when we step out, when we interact with people. You and I need to stay away from crowded places. You and I really need to rethink our plans of attending any large-scale events, any crowded events, or visiting such places. And the governments need to ensure that they enable an environment where this doesn't happen. They fix the problem of crowded public transports. They crack down on COVID violators, and they ensure that big events are not held, and if they are, then they are penalized. But tonight, it's about your queries, it's about your concerns, especially on the vaccine front. India really needs to now further step up on the vaccination front, which means that as we get ready to open it up to more and more people, there will be several doubts. And if you have such doubts, tonight on this panel, we will address those doubts. So our phone lines are open. The number's flashing on your screens. Pick up the phone and dial and tell us what your query is, and let our experts help you with it. And I say good evening to Dr. Rajiv Dasgupta, Chairperson for the Center of Social Medicine and Community Health at JNU, joining us this evening. I've also got Dr. Sanjay Pujari, Director for Institute of Infectious Diseases in Pune, member of the COVID Task Force. Dr. S.K. Sarin, Director for the Institute of Liver and Biliary Sciences, is also joining us this evening. We'll also have Dr. Samiran Panda of the ICMR also joining us right now. But let me first up actually go across to Dr. Rajiv Dasgupta. Dr. Dasgupta, and I'm going to continue with the conversation we were having with Dr. Guleria on the blood clotting reports. And why is it that we have decided that it's not a concern? Is it a concern? Is it different for people in Europe, the way they are responding to it than we are? Or are they overreacting?
Well, it's not a simple yes-no answer. From the European point of view, this vaccine has been, as one commentator put it, a bit of a political football. There were concerns about shipments, there were concerns about supply schedules, and now there have been concerns about potential adverse effects. So, on the other hand, UK has backed this vaccine, the WHO and EMA has backed this vaccine. So, there are conflicting signals even from within the European region. Now, that's one aspect. The other is, should we be worried? Remain worried with a new product, particularly new.
Dr. Dasgupta, we seem to have a bit of a trouble with your line. We're going to try and fix that line and come back to you. But Dr. Sanjay Pujari, would you like to come in as well on this aspect?
Yeah, I entirely agree with the previous speaker here about the perhaps a political thing. If you look at Europe, for example, the French president actually came out with a statement saying that AstraZeneca vaccine has limited efficacy in elderly population. And then some of these countries had withdrawn it from vaccinating elderly people, but then tracked back. So at this point of time, EMA and WHO is looking into the data. It seems that this vaccine associated or the clot seen in the vaccinated population is not higher than what is the expected prevalence in the general population of the clots. And moreover, EMA says that the benefit risk ratio of having the vaccine is much beneficial as compared to the risk of clot. So I think it's something in about maybe tomorrow the EMA is coming out with its recommendation and we will have the final say on this. But I personally believe there is no cause-effect relationship in this.
Well, let me actually say good evening to Dr. Samiran Panda of the ICMR. Good evening, Dr. Panda. Can you hear me?
Good evening. Yes, I can hear you.
So, Dr. Panda, let's continue with what I've been asking here about the whole blood clot controversy. If you can explain to our viewers, what is it that has been seen in some of these cases in Europe, which we haven't seen in our country?
So, blood clot everybody understands, so I need not to explain what is meant by blood clot. But the question here is, amongst some of the vaccine recipients, formation of blood clots have been found in the veins. Generally they happen, and if those blood clots get dislodged and go to the lungs or to the brain, we call them embolism, and that might be fatal. Now the question is this phenomena, which has been observed among some of the vaccine recipients, are they due to the vaccines or not? So we have to try understand an issue here. Anything that happens after I receive the vaccine need not be related to the vaccine per se or vaccine itself. So the cause and effect relationship, establishment of causality of an event is a scientific inquiry, and that needs to be done in a fashion which merits careful thinking and analysis. Even if we sort of look back what was happening during the vaccine trials and among some of the participants, if death happened, immediately there was a tendency to jumping to the conclusion that the death is related to the vaccine, but that's not the case. So anything that happens following vaccination, be it as a part of the trial or now we are in the vaccine rollout phase in the program, it will be too premature to say. And the evidence so far available with us globally tells us about or indicates no causal link between the vaccine and the clot formation. In India, we have an elaborate system of capturing AEFI, adverse event following immunization. And in that database, we have not come across any such occurrence of increased clot formation. So clot formations are known phenomena that happens, and as Dr. Pujari was saying after a couple of minutes ago, that this is not happening amongst the vaccine recipients in unusually higher proportion compared to the general population who have not received the vaccine. So as yet, I would say there is not a reason to be panicked about this.
Okay, we were also given to understand, and I believe that's still happening, that we're going to be reviewing all of the cases of hospitalizations or adverse side effects that have happened in India. Is there another live tracking mechanism that exists in at least some parts of our country to see how the beneficiaries and their health is responding to vaccine over a period of time, not just the first day or two?
Absolutely. So there are adverse events of various kinds. When one receives a vaccine, then that person is observed for half an hour or so at the vaccine session site, and there the whole intention is to identify if there is an immediate adverse event But then once that is not observed, a person is considered to be fit to go back home. There again, he or she is told to remain careful about any unusual symptoms that he or she experiences. And then the request is for informing the vaccinator or the immunization officer in a district, or even to the state immunization officer. And the COVID software that gathers and collects all the information about the vaccine recipients, that also has a provision to record the adverse events, be it of immediate nature or at a distance. Now, adverse events happening 3 months later or 5 months later will be a very rare phenomena. You don't expect that to happen. So spectacularly low that probability would be to have something as an adverse event recorded in somebody who received a vaccine 5 months ago or so. But in the short term or in the medium term time gap I am talking about, whether the adverse events are happening or not, that will be recorded very efficiently, because we do have a very robust immunization system in India, and on a regular basis, even if there is a hospitalization, why did a person who received vaccine and following which he or she got hospitalized, that gets reviewed, and this is called rolling review or in a real-time review.
Okay, thank you for elaborating on that. Since we are talking about side effects, and as far as blood clots are concerned, our experts now saying that it's not a concern in our country. We haven't even seen much of it, but even internationally now experts are saying that the benefits of the vaccine far outweigh this. Reasons for some of the countries suspending it could be political or anything else. Dr. Sarin, what are the other side effects that we are witnessing in our country that people should be mentally prepared for, which are not to be, not something that we should panic about, but perhaps prepare ourselves for?
I'll simplify some of the questions and concerns and of the worthy panelists. One are immediate side effects. One is early. Early can be up to 8 days, and one can be beyond 8 days. And the reactions seen by any vaccine, let that be Pfizer or Covishield or Covaxin, have been same. So people should not compare one vaccine to the other. Second is the side effect phenomena, which is if you have an allergy, please be prepared to inform people. If you are on thinners, please inform so that you are protected. The third thing is, in case there are some concerns, I think it is natural that people have some concerns. I think we all are working, and I think the government will soon come out with the audit of the reasons of any adverse event, and that's a natural process. Fourth, what Dr. Panda said is adverse event following immunization does not mean that the event is related to immunization. Any adverse event following immunization can be 30 days. It could be cardiac death due to natural reason. It could be stroke. It could be anything. So following immunization is not related to immunization, that people should understand. So that can be part of the history. Now, mental levels, yes. Are people ready? Are they hesitant? We are getting messages. Many people say, should I take the second vaccine? Should I take the same vaccine? I would say yes. The second vaccine may be marginally more local side reactions, but not any other side reaction. So please do take your second vaccine. The third part is don't change your vaccine to another vaccine. Take the same vaccine as has been given earlier to you. Do not miss your dose. Very recent data has shown that if you were having exposed to COVID, let's say you had COVID, should I take a vaccine? Yes, this data is published just about a day ago in New England, that you take one more dose. If you were exposed, then your antibodies can be going very high, maybe protected. So please do not escape a vaccine if you get one, even if you had COVID in the past. So mentally be ready. The vaccines are safe. 35 million have got it in India, and the adverse events are probably in no case more. Yes, we need some answers. We are all working on that. So in my opinion, it is safe, and we should go ahead. In fact, the vaccination drive should be doubled up as the numbers are spiraling, or maybe tripled up, and people should line up for that.
Oh, yes, absolutely. And I think, there was a bit of a hope today when news emerged, perhaps that the health ministry was, going to propose to at the meeting between the Prime Minister and the Chief Ministers that we should open up to everybody above the age of 45. But then the health ministry said that they've not made that proposal yet. But one is hoping that it is in the works and will actually be implemented soon. And we just open it up to more and more people. Perhaps it's the only solution, fast-paced solution actually to solve this problem. Dr. Rajiv Dasgupta, I believe you're back with us. We lost your line. Do go ahead and finish your point. And also, because we were talking about, some of the comorbidities, what about people who are on blood thinners? Should they be concerned about the blood clotting controversy?
Thank you. Yes, I got disconnected. I'll just take a couple of minutes to read the statement from the International Society on Thrombosis and Hemostasis. The position of their international panel is as follows, and this is just 3 days old statement. Based on all available data, the ISTH believes that the benefits of COVID-19 vaccination strongly outweigh any potential complications, even for patients with a history of blood clots or for those taking blood thinning medications. It also recommends that everyone review the signs and symptoms of clots, including leg pain, swelling, tenderness associated with the deep vein thrombosis, as well as difficulty breathing, chest pain or discomfort, and a few other symptoms. And of course, as Dr. Sareen emphasized, individuals with coexisting medical conditions may wish to. However, these should be read with two things. One, that the initial concern in the Europe, particularly Austria, was on a specific batch, the ABV5 doses, so that's quite a sizable number. So the concern was not really initially around the entire Astra Zeneca, but initially on this batch, and that was undergoing investigation in the Europe have suspended that respective the batch. The other thing that we should remember, and let's be honest, that adverse immunization may be small, they may indeed be rare, but with new vaccines, one may also come up with unsuspected AEFIs, and therefore this is what we call AESIs, adverse effects of special interest, and therefore this requires a very high index of suspicion. So the Norwegian position on this is that they currently have 3 patients in the hospital, and I use under quotes, present a rare disease picture due to the patients having an unusual combination of low platelet counts, blood clots in small and large vessels, and bleeding. Similar combinations of symptoms have not been seen in people who had other vaccines. That's the statement from the Norwegian Medicines Agency, and that's one of the things that EMA and NMA are looking into, and therefore this is something we should be cognizant of, and we are indeed, as I said before I got disconnected, doing a deep dive of the data. Thank you.
Okay, fair enough. Thank you so much for, also shedding light on that angle. Now, if you, my experts would allow me, let me bring in some of our viewers who have some queries, which I believe you all will be able to help better with. Jagannath Prabhu is on the phone line calling us from Mumbai. Good evening. Go ahead, please.
Good evening. Thank you for having me on your show and asking this question. I would like to know what are the provisions for vaccinating the elderly, people who are infirm, bedridden. They have Aya boys and ward boys coming and going. They need protection too. What's the provision for them who can't come to a COVID vaccination center?
Okay, fair enough. Interesting question, and initially we had asked this question as well because we got a lot of these queries. Dr. Panda, the initial understanding was that, well, right now it has to be done under the medical supervision. We also need to observe how people respond. So we will need people to come to the vaccination centers. But is there any, any other possible way that can be explored going in the future when we open it up to more people, where we take some of these medical experts and set up camps closer in the residential localities?
All right. Gradually, if the need be, the vaccination program, which has been rolled out in the country, needs to be innovative in the sense of implementation of it. So I would say that the initial need is to identify the priority groups, which the country has done. So elderly people or the frontline workers, they need to receive the vaccine. But the question is, if they cannot come to a vaccination session site, what could be the alternative arrangement for them? And I would say that there is a serious consideration about engagement of the organizations which worked for the national program in the past. For example, the Rotary or the Lions Club or the community-based organizations, if they open up a dialogue or a conversation with the state health authority, and particularly the state immunization officer and the district immunization officers, if we know about the locality, then it can jolly well be organized, and that I'm convinced about it. However, we need to remain aware of the fact that following immunization, one needs to be really observed for half an hour or so because of the possible immediate side effect. So we should not take that lightly. So on one hand, we should think of innovative implementation strategy. We should remain sensitive to the need of people who cannot come to the so-called designated and operating vaccination session sites. So one has to have a dialogue, and the community engagement has a great role to play there. And there is a serious consideration, not only by one state, multiple, because being a member of the NECVAC, the committee which serves as a think tank to the government in terms of different implementation issues, many states are open to this idea of innovative implementation strategy. But be it health camp situated closer to the residential area or some other place, but we should always remain aware of the fact that the immediate observation should not be taken lightly.
Yes, in fact, that's one of the reasons, that often is our experts point out. So I hope, Mr. Prabhu, that helps you understand why that policy is not in place right now, because it's extremely important to see the way, any beneficiaries responded and keep them under observation with medical experts around. Let's also go across to Ashok Sharma on the phone line from Delhi. Good evening.
Good evening, ma'am. Well, I would like to ask the question to the expert panel over here, doctors, that I am 75 years old and I have taken the first dose. I am a diabetic and I am on blood thinners also. And I'm perfectly all right. And I would like to request all the senior citizens that they should go and take this vaccine. But a friend of mine who is 84 years old, when he went to take his vaccine in Gurgaon, and he was told that 3 days before taking the vaccine, they should not take blood thinner. And 1 day after taking the vaccine, they should not take blood thinner. So I would like to request you that if the doctors can explain that, is this true that we should not take the blood thinners before taking the vaccine and after the vaccine?
Thank you for calling. A very, very pertinent query, and I know a lot of our viewers have that, related queries as well. Dr. Sarin, would you want to go ahead first?
Yes, first, congratulations. You are a young 75, and we recently had a young 96-year-old who just walked and thumbed his forearm and arm and said, give me a shot. And he got the second shot also, and he's doing all right at 96. As far as blood thinners are concerned, aspirin up to 75 milligram is no botheration, up to 150 also. And I think one should not bother up to a normal ecosprin or aspirin dosage. So you can go ahead and get your shots. Yes, if you're on double, let's say you got a stent recently or on your double antiplatelet drugs, you should certainly caution, and maybe a day before or so. It's an intramuscular injection, so it's unlikely to give you a bleeding like any other procedure. But yes, you should inform the doctor and maybe a day earlier you can withhold. But 3 days is a bit long. Platelets have a short half-life of about 8 hours to 12 hours. So major procedures, doctors would say, yes, hold on for 3 days and 1 day after. But yes, these are a small subgroup of patients where the risk of bleeding has to be weighed against the risk of clotting of the stent. If the stent gets clotted, is that worse? Or is your bleeding at the arm site is worse? So that the physician, the cardiologist can take a look and decide. The next part is how long you should wait there. I would say instead of half an hour, such patients who are on thinners can wait a little longer if they can, an hour or two, and then just address the issue with the nurses. And when they come home, also can look at the local side. They also have a local responsibility that they look after their part. So I don't want people to be scared. I think it's a fairly safe, simple injection, intramuscular injection, and you should take it.
All right. Thank you so much for explaining to our viewer, because this is a query that we've often got. Now, while we get in more of our viewers to call in with their queries, I also want to talk about what should be our plan to step it up from here on. Dr. Pujari, for example, Maharashtra is a state that is witnessing a big spike in COVID cases. Now, will stepping up vaccination right now help us? What can be done? How much more can we open up? To what extent to really contain the spread?
Yeah, so if you look at the current surge in Maharashtra, I think vaccination would just be one element of stepping up vaccination would just be one element. Remember that giving a vaccine is not going to protect you from COVID-19 tomorrow, the next day. It usually the recommendation is that it takes at least 2 weeks after the second dose. So we're looking at a window of 1.5 months. Even if we step up a vaccination and escalate it to a population level, to see a population level impact in trying to reduce the COVID-19 incidence. So I'm not saying that vaccine is not important, but I think it's just one element. But most critical element right now to control the surge is perhaps a significant amount of intensification of testing, tracking, trying to establish micro-containment zones, and most importantly, community involvement, particularly people. Again, we need to re-emphasize, I don't know how many times, that you need to make sure that you wear masks consistently, you avoid crowded settings, and you maintain hand hygiene. And another aspect which I would also like to re-emphasize here is if you're ill with any acute respiratory illness, stay at home. Don't neglect it, saying that it may be something which is not COVID, because I'm seeing a lot of patients who think that an acute respiratory illness is not COVID, and then they go around without getting isolated. So I think all of these components is important, as well as simultaneously trying to scale up vaccination to first reach all the priority groups that the central government has come out with, and then perhaps also simultaneously gradually expanding to other groups as and when the guidelines come. But the impact of vaccination is going to take time at population level to start showing a decline.
Yes, in fact, let's reiterate this part, that any kind of impact and benefit will only kick in post 6 weeks from your first shot. And that also, if you take your second shot right away after 28 days, after 4 weeks, and then you have to wait for at least another 2 weeks for that immunity to really kick in. So at least 6 weeks, which is why we cannot turn around and say, oh, vaccines here, people are getting vaccinated, so why should we be concerned? It's all right to start stepping out, it's all right to travel, don't be, don't spread fear or don't be fear-mongering. And I get this a lot, which is why I really wanted our experts to emphasize on this fact, that it will still, even if you get the vaccine, at least take you 6 weeks before any impact really kicks in. So then, what is our other big concern that has emerged in this vaccination drive that we've seen in the last couple of months? It's been about this controversy that emerged, Dr. Rajiv Dasgupta, internationally, where they said that you need to wait longer than 4 weeks for better efficacy, especially for the Astra Zeneca vaccine, where it was said that, if you wait for 6 weeks or 8 weeks or even 12 weeks, 8 to 12 weeks being a better option for higher efficacy. What does that mean? And should we be re-looking at our strategy?
Well, we discussed this earlier. Also, the government of India's position is that we continue to stick to the 4-week schedule, and that's got a reason, because vaccine logistics in a country of our size and diversity is extremely complex. Immune response does indeed vary over time. That's pretty well known. But as far as the programmatic logic goes, India is not making any change in the schedule as of now.
Dr. Panda, would you like to weigh in on this? Does the efficacy differentiate a lot if you take it 4 weeks later or 12 weeks later?
I had the opportunity of looking into this subgroup analysis, and I would say that it's not the huge difference in the efficacy if you look into the uncertainty bound around that efficacy figure. So I go exactly with what Dr. Dasgupta said. 4 to 6 weeks is the time period which is the gap between the 2 successive doses of Covishield. Because the whole debate is around Covishield, should we, increase the interval? We need to appreciate and remember that the disease transmission dynamics within the country for some of the states are showing upsurge or upwardly going trend. And given that epidemiology, if you increase the interval between the 2 doses, there is a risk of breakthrough infection. Meaning you have received, or one has received the first dose, and while he or she is waiting for the second dose, during that period he or she might get the infection, which is called breakthrough infection. And we cannot afford to put huge number of people, Indians, to that risk. That's the second issue I would urge everybody to remember. And thirdly, this infection might even be by not only the older circulating strains, but the new variants that we are talking about. So given that there are program realities that Dr. Dasgupta was very rightly underlining, and this whole issue of not much variation, because all these analyses which are talking about increased efficacy if we increase the interval between the 2 doses, that subgroup analysis and on a very limited number of people, and based on that sort of analysis, we should not, it does not merit considering a change. So the actual or appropriate framing or the messaging would be probably that take your vaccine, the second dose of it after 4 to 6 weeks of first dose of Covishield. If you cannot do it for whatever reason, please go ahead and take it at least within 8 weeks of the first dose. So that means even if you forget it, then you need not to think, oh my God, I missed my second dose, so now what do I do? No. If you have missed out your second dose in terms of not being able to take it within 4 to 6 weeks of the first dose, please go ahead and take it. But don't delay it as much as you can with the hope that you will have increased efficacy, because actually then you are increasing the time gap between the 2 doses and putting yourself to the risk of breakthrough infection.
Yes. Dr. Pujari, you had something additional to add?
Yeah, I agree with Dr. Panda's point about the infection between interdosing interval. And if you see the study, as Dr. Panda rightly mentioned, is in between, if your vaccine is going to be protective, has high levels of protection after a first dose, then only this is something which is worthwhile. Otherwise, you may start getting breakthrough infections. The second concern, which is although theoretical, but I think very difficult to explain, is in between 2 doses, the levels of the antibodies are very less. And if you get exposed to the virus, there is a possibility that the virus may develop mutations. And this is one of the mechanisms by which under suboptimal antibody response, you give an opportunity for the virus to mutate under selection pressure. So that is also a theoretical concern which should be borne in the back of our mind.
Okay, so it's better to get your second shot between 4 to 6 weeks. In case that you are not able to, you still have the option to go later. That's how one should be reading into the study that's emerged. Always better to go ahead with what the vaccine developer themselves have found in the trials that they've conducted, the exhaustive study that they've done. And if the vaccine maker and the developer says 4 weeks, that's what we're going to be sticking with. Very quickly, we've got 2 more viewers on the phone line with interesting queries. Mr. Ravi Mehta on the phone line from Mumbai. Good evening. Go ahead.
Good evening.
What would you like to ask?
Yeah, I understand that the vaccination is not effective on 100% of people who take it. And my question is that for those for whom it is not effective, will it at least protect them from serious disease or death?
Okay. Thank you for calling. Dr. Pujari, would you like to take that?
Yeah, so I think all the vaccine platforms have shown almost 100% efficacy against severe COVID-19. So even if you get infected, it's more likely that you may have a mild infection or even an asymptomatic infection, and you may come out of it. So I think the best part of this is the need for hospitalization, the need for management in hospitals or severe disease, COVID-19 is less. The other important aspect is this understanding. Again, I'm sorry to be a little statistical in this, that, if you are saying 95% effective, it doesn't mean that 95% of people are getting no disease and 5% people are getting disease. It's based on background levels of infection in the community. So essentially, to answer this question, I think the large evidence suggests for all platforms that it's almost 100% for severe COVID-19, protection against severe COVID-19.
Yes, and that's the part I think that our caller also wanted to know, that when it comes to serious cases or preventing death, there is almost 100% efficacy that we're looking at. P. Saroj is on the phone line from Bengaluru. Good evening. Go ahead, please.
Good evening, ma'am. Thank you for giving me time. I was told that the people with allergies it's a dangerous thing to have vaccinations done. So I have some sort of a dust allergy, which is causing some dermatitis and things like that. And I'm on homeopathy medicines, and it's not much of an issue, but I'm doubtful whether I should still take a vaccination or not.
Okay. Thank you for calling. Dr. Panda, would you be able to help our viewer?
Sure. Anybody who is having allergy, as expressed by one of the listeners, like dust allergy, which is not of severe kind, and for example allergic rhinitis, or even people who are having asthma, these are not the contraindication for taking a vaccine. So yes, you should go ahead and take the vaccine. Those who have history of severe allergy to any drug or food item, or even following any other vaccine, they should refrain from taking the vaccine due to the past history of severe allergy, and particularly if that is also associated with admission in the hospitals, which required intravenous drip administration, steroid injections, etc. So in essence, what I'm trying to say is that minor allergies, history of that, or allergic rhinitis or asthma or dust allergy, these are not the contraindication for vaccination. So please go ahead and take your vaccine. If you are on on some medication, then I would say that as we do not know about drug-drug or drug-vaccine interaction, it would be useful or advisable to stop that medication for a little while, complete your vaccination, avoid getting exposed to the allergens or the agents that you are allergic to, and then again, in consultation with your treating physician, you can resume your medication that you were on.
Okay, in fact, let me just make it a little bit more broad-based in what our previous caller also asked. And Dr. Saran, what would be few of those things or medicines that people are on, or treatment that they may be undergoing, where they should first refer to their doctor, speak to their doctor before getting the vaccine?
Well, if somebody is on any cardiac medicine, anti-cancer medicine like chemotherapy, which are immune suppressants like steroids and others, or immune modulators like what nowadays is very common called checkpoint inhibitors, which is used for most malignancies and others. So anything which changes your immunity or your clotting, these are the two major groups where people need to tell their doctors and get them informed. For example, somebody is regularly taking steroids or bronchial asthma, which is intractable. Well, he needs to inform, not that he cannot take vaccine, but he needs little more supervision. So he needs to inform. Somebody who is on chemotherapy, but it is stable, he doesn't have to worry. He can take the vaccine. In fact, cancer patients are more advised to take vaccine. But if your therapy is like where your bone marrow has been suppressed, you don't have enough platelets or white cells, or your hemoglobin has gone down. So such kind of patients, for example, you have a post-transplant patient for liver transplant, which we regularly do, then such patients can take vaccine. But yes, if you are in a phase of rejection of your organ due to something, such patient, or severe sepsis, or infections of any course, like you're running high grade fever. So in all those situations, one need to be careful. They are not kind of healthy. Vaccine is made to be given to people who are otherwise in a normal state or near normal state of health, so that they get antibodies developed. But if they are already fighting with something, it's not a great idea. I want to add one more thing, which earlier wise panelists said. Yesterday only this data came from in New England again, that the Covishield or the Astra Zeneca vaccine is not any more effective than placebo in patients who are got infected with the South African variant. Now that has not entered India, but few cases have been reported. So my suggestion would be that people should take first dose, as many as people who can take first dose fast enough. So in 2 weeks' time, you have some antibodies, and do not delay. Take your second shot at 4 weeks' time, so that you at least are in that league that you are close to protection. Because if the new virus comes, maybe. So if you have already taken vaccine, you may be protected.
Okay.
But if you are starting when the virus is there, then you may not be protected. So reinfection, severe infection, going to ICU or death, all can be protected if you have taken both the shots timely and you have taken precaution of not delaying the vaccine too long.
Okay, fair enough. Thank you so much. And it's been an extremely enlightening conversation to have all of you here. Thank you for taking the queries that our viewers also got us. I appreciate you taking the time out. So there you go, viewers. I hope it was helpful to a lot of you. Concerns about blood clots, do away with them. Not needed. As far as we know right now, we don't have such instances, such concerning instances in our country. The WHO also has right now has said we're going to go ahead with the use of Covishield, the Astra Zeneca vaccine, and in our country also we're going to do that. Any other concerns, some of which were addressed here, but if you have doubts, all you have to do is call up your own doctor who you regularly, frequently visit or knows your history, or speak to any doctor that nearby, and ensure that your doubts are clear, and then go ahead and take your vaccine when the time comes for you. If you're eligible already, please go out, then we'll have to wait for the turn. But for now, India needs to remember two things. Wear your mask, follow COVID norms, and the minute you have your turn ready, go ahead and get your vaccine shot. Thank you so much for joining us.